Bear with me, folks, because I've never had bifocal glasses before, so this is the trial run. Okay, good afternoon, everybody. The title of our team's presentation is Palliative Care, Asking the Questions That Matter to Me, and we are in Group 4, which is at Group Table 4 as well. Okay, just 2 wee seconds. The background as to why we chose this topic is because research into palliative care has continually highlighted communication as one of the most vital aspects in medical care. Unfortunately, as we all know, evidence shows that the healthcare professionals don't always communicate effectively. Another reason as well is because at clinic appointments, palliative care patients, due to the nature of their illness, tend to forget what they want to ask the doctor or the consultant, only to remember at a later time or date, resulting in patients and carers feeling vulnerable, patients and carers feeling loss of control in the palliative care process. The All Ireland Institute in 2015's report on the Community Learning Project identified the need for a question checklist for palliative care patients and carers in preparation for going to a doctor's appointment. The recommendation stated that it should be available in both printed and online format. The aim of our group's project was and is to develop an information resource for palliative patients and their families, empowering them to ask questions specific to their individual needs. This information resource will be published in booklet form and also accessible through the All Ireland Adult Palliative Hub. The members of our group cover the length and breadth of Ireland, from Derry, Antrim, Belfast to Dublin, Limerick and Kerry. And as you can see, it is Lorna, Anne-Marie, Sister Patricia, Joanne, Helen and myself. Our approach was a team approach who devised a Gantt chart and tasks allocated to each member. A literature review was completed and a resource from Australia, Asking Questions Can Help, was very relevant to our team. This was then adapted to meet the needs of our patients in Ireland. The team sourced vital patient carer feedback from, again, Voices for Care, where some of our team went to meet them on the 18th of June, Milford Care Centre, Kerry Palliative Care Services, St Francis Hospice, and in Northern Ireland it was senior managers for community development, the patient and public interest groups across all 5 trusts. The feedback enabled us to make amendments to our document. The booklet then was approved for correct grammar and plain English, and also it was sent then for graphic design and for printing. I'm delighted to say that we have circulated out to yourselves the finished product. There are a few copies in each table for you to view. The areas within the booklet include palliative care services and teams, living with my illness and treatments, support, and end-of-life issues. So what were the key challenges for us? I think, to be truthful, they were similar to all the groups. It was trying to network with each other across Ireland at agreed times that suited all of the group, some of us managers and some of us clinicians. It was the competing work demands versus the project work. And the key thing was, it was about trying to come to an agreement in addressing the comprehensiveness of this subject to capture the depth and breadth of palliative care services across Ireland. So what were the highlights for us? The main highlight for us was the very positive feedback that we received from Elizabeth Fitzgerald on behalf of Voices for Care. She stated, "What a really useful tool to have, well done to all. I really like the title, Asking Questions That Matter to Me. It gives permission to do just that. The list of questions seems really comprehensive, and the space for additional questions gives even more permission to ask the questions that matter. This is such an empowering tool Knowing the questions to ask and being able to ask the ones that matter can make such a difference to the care that a person receives. This impacts not only on the quality of life for the person with the illness, but also on his or her loved ones. I hope this is useful. It is an honour and a privilege to be involved in this work, and I look forward to seeing the final document. So what have our team's reflections been on the last year's journey? Well, like all the other teams, it is about getting to know each other with different cultures, different backgrounds, and most definitely different personalities. It is about developing a booklet for the patient and the collaboration and the positive support and help the team received from colleagues and patient and carer groups. It was as a group of professionals looking at the needs of the patient and the carer's perspective, and not on the professionals as we would normally be used to doing. It was about time management. It was about balancing the work and project and home life. And I have to say many thanks. It was also about the invaluable supportive roles from Kathleen and from Garth at the All Ireland. So what is our next steps? Our next steps, number one, is to pay our bills. To ensure that the booklet is downloaded onto the All Ireland Palliative Adult Hub. To devise a plan for distribution of the booklets across the island of Ireland. And finally, to celebrate our team's success. Our total budget was €3,000, and the money to date was spent on designer and printing of 1,000 booklets. Paddy, we are €148.41 overspent. And we don't mind, we don't care. The in-kind contribution from the All Ireland team we would also like to recognise here, so many thanks to them. So a little final thought, and to me this sums up why we did this. If I had an hour to solve a problem and my life depended on the solution, I would spend the first 55 minutes determining the proper question to ask. For once I know the proper question, I could solve the problem in less than 5 minutes. And that was Albert Einstein. Thank you.